All right, well, to be mindful of everyone's time, and a special thanks to Denise for this presentation, we'll get started without further ado. So what I'm going to do is start to share and to introduce, first of all, Denise Cruikshank from Queensland Health.
Yep. Hi.
And we will start. Just move that out of the road for you there. Hopefully that will be okay. And you can just...
You don't want to put it on presentation?
We can do that.
No, please.
Yep. Here we go.
Okay. Okay, welcome everyone. I'm just going to take you through a project that we've been doing in Queensland Health around the implementation of IDDSI and how we're progressing with this. So basically I'm going to go through the background, which most of you know already, so I won't spend a lot of time on that. The process we went through to implement IDDSI, the resources that we've developed and where we're heading next. And I'm going to show you a couple of resources as well. So as you know, IDDSI is rolling out around the world, and it's going to be coming here to Australia on May the 1st, 2019. So Queensland Health has around 137 inpatient residential facilities, plus in addition to that, outpatient clinics that potentially we need to get information and communication out about IDDSI. Queensland Health has a statewide contract for thickened fluids and also for texture modified foods, which is embedded into our food contracts. So that's part of why I'm involved in this process, because we manage in statewide food services the contracts for these parts of the food service people. So we developed it, or we put together a statewide implementation committee in December 2017, just after the IDDSI implementation was endorsed into Australia. We have a representative from every hospital and health service in our state, which is 17 in total. And those representatives are speech pathologists, dietitians, food service managers, and we're trying to get nursing involved as well. We have got nursing at a couple of sites, but we're hoping to get more of those involved. And we were meeting monthly via teleconference. So what we agreed within that group was that we were going to implement the IDDSI terminology, colours and testing methodologies for the thickened fluids into Queensland Health from May the 1st, 2019. And fortunately, our thickened fluid contract was due to expire at the end of this year, so we extended it for another 6 months so that it would then coincide, the changeover to the new contract would coincide with the implementation of IDDSI. However, we have delayed the implementation of the IDDSI terminology and testing methods for texture modified foods because our statewide food contract is not expiring until September 2019. So we thought that it would be best to not implement IDDSI until that contract was ready to change over. That way we could actually include the IDDSI terminology and the IDDSI testing methodologies into that contract. So at the moment we've been focusing on implementing the thickened fluid changes. We did decide not to implement the IDDSI colours for texture modified foods into Queensland Health at this time, and that's because our statewide food contracts are based on bulk food, so the patients don't actually see anything that would have colours on it potentially, apart from maybe some of the individual desserts. But in our organisations, most of those come in bulk format or in pre-moulded, and they're not actually packaged, so there was no point in having the colours. That may change in the future, but for how we work here in Queensland Health, that was the decision that was made. So over the last 10 months, the implementation group, we have put together an IDDSI implementation plan and an IDDSI implementation timeline. And you can see there's ticks there for the things that we've already achieved. We also decided probably around July that we may need to have some additional support to implement IDDSI and get the message out there as quickly as possible. And so we put together a concept brief for an implementation project officer. So the implementation plan, the main aim was to transition from the Australian standards for texture modified foods and fluids to IDDSI safely and effectively from May the 1st next year. So our objectives were around awareness raising across our facilities and staff, identifying and developing resources to support that awareness and also the transition to IDDSI. Hang on a minute. Okay. And to embed the IDDSI into the terminology into the upcoming statewide food and thick fluid contracts, and then to ensure the actual transition was as smooth, safe and effective as we could make it. So we identified our stakeholders. Clearly, my area, statewide food services, was driving this, so we were the key stakeholder in terms of support and coordination. Health Support Queensland, which is our contracts arm in Queensland Health, so they're a big stakeholder clearly. Our dietitians, and we have a group of dietitian managers that meet together regularly from around Queensland Health, and the same with speech pathology. They also have a statewide group of speech pathology directors that meet, so they're another one. Food service managers, and of course our hospital and health services. And one that is actually missing off that list was our suppliers, but they sort of come in through the Health Support Queensland arm because they do all the supplier contract support and interaction. Oh, okay. We're just having, okay. I'm just having a bit of trouble. There we go. Thanks. So stage one was awareness, and we're currently in that stage, and this is ongoing. So we developed a communication plan, and we identified our target groups, and we have been sending out communiques with the implementation of IDDSI. So we've sent something out to the executive. So RPOC is our Allied Health Professional Office in Queensland, so that gets to all the allied health professional people and the allied health assistants. Our Chief Nursing Midwifery Officer, so making sure that we have our nursing executives aware, and the Food Services Rural Unit, Food Safety Rural Unit, so we've got all that covered as well. And then we've got our CEs within our HHSs, our chief execs, our allied health, our nursing, our chief operating officers, our medical staff. Speech pathology, dietetics, operational services and food services, and procurement. So they're the communication channels. The next stage was mapping food and thick and fluid supply and menus for IDDSI. So we were originally going to do a lot of mapping, and some sites have already done that around their menus and the transition to the IDDSI terminology. So the sites that cook mainly fresh have already done some work around that or are in progress with that work, and they may actually transition a bit earlier than those sites which use the statewide food contracts. In Queensland Health, most of the rural sites tend to cook fresh. The bigger sites are the ones that tend to use the contract. So we needed to identify gaps in supply, and clearly some of the IDDSI, like the soft and bite-sized, was one that we had a big gap in a lot of products. So we're going to be working with our suppliers over the next 12 months to develop additional products to meet those gaps. So that's part of that mapping, that we've identified those gaps, that we can liaise with procurement and industry around the change to the specifications and what we require to fill the gaps, and then develop IDDSI compliant critical and non-critical auditing methodologies for use in the SOA. So we've actually been working on that for the thick and fluids, and that's recently just been completed. So that auditing methodology has been finalised for use within Queensland Health, so that all of the speech pathologists are using the same methodology, and that's around, the temperature that they're testing the thick and fluids, and in addition, using the test tube. Flow test, that's right, sorry. Bit of a mental blank there. The flow test and how whilst they're using the IDDSI methodology, they have put some levels are slightly different, so there's a gap between the levels. So they put a little bit of a gap there to provide some a buffer zone, to make it very clear what thickness is what. So that's something that they have finalised just recently, and we've been working with one of the suppliers to test some products to make sure it works, and it seems to be working quite well. We're also looking, when we move to the food IDDSI, the impact of IDDSI on food service, because that's going to impact different production systems, IT systems. And so during next year, when we're working on our GAP products, we will be starting to do that. At the moment, we're just focusing on the fluids. So the commencement implementation, so that's going to happen next year. So probably from about February onwards, we'll be right into doing all of this, sending out regular communiques, updates, sending out resources, making sure everyone's aware that they have a local IDDSI champion, so that sites can have one person that we can communicate with to get all that information out, and then they're responsible for actually on the ground making sure that communication happens. And then the next step, which we've already started, is for the renewal of our statewide contract for thick and fluid. So that goes out, those specifications have been finalised. That's going to go to market soon, and we will be ready to roll with that as of May the 1st next year. Developing resources, we've been doing that, a little bit of that ongoing, and there's still more to be done. So we've got an infographic with web links that we want to develop. We haven't developed that yet, or PowerPoint slides for local updates. We haven't done that yet, but we do have a poster which can be printed out in A3 or A4 and laminated and put up in places like ward pantries, nurses' stations, on fridges where thick and fluids might be kept, in the kitchen, those sorts of places, to make it very obvious. We're going to have a screensaver go up on our statewide internal electronic publishing system, so that when people log onto their computer, they will see the IDDSI information coming up and the awareness of it starting. And we've also got some handouts that we've developed, some frequently answered question handouts, and we're adding to that as we go. We've developed a short video which is available on our internal system, and I'll show you that at the end of this presentation so you can have a look. This is based on an animated tool that is easy to buy, it's just commercially available, and one of our health services, Townsville, developed this for us. And then we're going to have to review all of our texture modified resources that we give to patients, which is currently sitting on NEMO, which is our nutrition education materials online. Those are available on the internet for anyone to access, but they're all peer-reviewed resources that are made available on the internet for people within and outside Queensland Health. So when they're updated, they will be ready for publication before May 1st next year. You can access these on the NEMO website. So post-implementation, we have also identified that we need to monitor how things are going and identify any issues as quickly as possible so we can respond to them. So once implementation has occurred, we're going to monitor our Riskman, which is our incident management system within Queensland Health, to ensure that there's no specific issues that seem to be cropping up all the time that we may be able to intervene and correct. Also monitor, do monthly audits so we can review against our targets and see how people are going with implementation, and also to monitor industry supply issues through the contract non-compliance process. So we will be doing lots of monitoring, with particularly the first 3 months from May the 1st. Hopefully most of the implementation will have been completed by then, and we should be into business as usual after that. We, however, will continue to monitor the Riskman incidents and any non-conformances with the contract up until the end of the year. And then once we've done that, we're going to write up a final report and just summarise lessons learned and how the process went for and of course we'll be well into the implementation for the food as well by then, so that'll become part of that. Key performance indicators. So we've identified that the main things that we're going to be measuring are that we want all the HHSs engaged. So how much engagement is there by HHSs on the implementation work group? So far there's been 100%, but not all attend meetings all the time. That the fact that we've completed the implementation and communication plan, so we've ticked that one off. As I said, the contract's about to be reviewed and finalised, so we'll get that one ticked off by May 1st. The second contract, 66-67, is the food. That will not happen until October next year, so that's still to be done. And along with that, the review of impact on food services. And we're in development of resources to support transition, so we're going to tick that one off, obviously. And then hopefully we'll have everyone ready for implementation by May the 1st for the thickened fluids. And as I said, then the number of clinical incidents reported in that first 3 months. So just to go through some of the enablers for this process within Queensland Health, one of the big advantages we had was that we had central coordination, and that's through our statewide food services unit, which is where I work. There's 2 of us in this unit. So we have statewide coordination role that organises meetings, resources and communication, and that's a dedicated resource, not just for IDDSI, but for any food service support. So clearly this sits in that. We have a speech pathology statewide governance group, so that's helped enormously with getting consensus and feedback quickly, especially around standardising those methodologies for testing. And we have identified food service speech pathologists that sits on our statewide food services network oversight group, so that we can take any issues to that person and there's someone we can go to sort problems. So that's been very useful. The other thing is we have representation from all our hospital and health services. We have statewide contracts in place, which helps us coordinate, as I said, the methodologies and the specifications, and we can control the timing of when things come in. And we have very good working relationships with our suppliers, so that's also been very much an enabler. Barriers. So unfortunately we were unsuccessful in our submission for a project officer, so we've had to ditch that, and that's slowed things up a little bit, but we're still progressing. There's a lot of competing work priorities out there on the ground, and that's always a problem. So, and for us as well. So we're just trying to keep on top of all of those things to make sure the communication is consistent and ongoing. The structure of our organisation is sometimes not conducive to get people working together on one contract. So we've had a few issues around getting those contracts sorted. Not so much the thickened fluids, but the food one's been a bit problematic. So that's a barrier. There are a lot of staff changes. So that communication list and the implementation work group mailing list is a bit of a headache to keep up to date, because I'm constantly getting emails from people saying, oh, I'm going to be on leave for 3 months, can you put this person in instead? So that's a challenge. There's variable communication across the health and hospital and health services. Some work as a cohesive health service and they have really good communication channels. Others work in little silos or little individual facilities, and that's a bit harder, because when you have one person as your main communication channel and they're sitting in a particular facility but not having formal communication or pre-set up communication channels with the other facilities, that's a bit harder to try and get that message out. And of course the timing for the contract renewals was a bit of a barrier, particularly for the food. So where we're heading next, so we're going to be sending communiques out to our patient safety and quality through December, just so they're aware that there may be some safety issues that will need to be monitoring by Riskman. Again, to our chief executives and nursing directors early in 2019, particularly highlighting the resources and the education that needs to happen on the ground. We will upload all our resources to our webpage internally at the end of this year, ready to roll for early next year. We don't want to put them up too soon because we feel they will become a bit invisible if they're up too early. So we want to hit the ground probably about mid to late January, when all of the Christmas holiday people start coming back. We're going to put all them up then. We're going to finalise our contracts through 2019, and then we will liaise with our suppliers around the transition to the new products and labelling to make sure that that works as smoothly as possible. So the resources that we have developed so far, we have a poster which can also be printed off as a handout. What does the new International Dysphagia Diet Standardisation Initiative mean for your facility? So it's about the changing of colours mainly, which is the biggest risk. So that's what's highlighted in that poster. And we've utilised one particular company's products in this because at the moment that's who we have our statewide contract with. We don't know if that's the case ongoing, but if that's not the case leading into the changeover, we will update the poster. And the frequently asked questions, there's also a handout for that. And now I want to show you the video. So if you can have a listen to this, this is the video we developed.
Welcome to a short training video on IDDSI. This training is useful to anyone who encounters thickened fluids whilst doing their job. IDDSI stands for the International Dysphagia Diet Standardisation Initiative. It is a new framework to measure and classify food and fluids for those with difficulty swallowing. This is called dysphagia. Individuals with swallowing difficulty may need texture-modified food and fluids to help them eat and drink without choking or aspirating. Let's look at how the new framework was developed. A worldwide stakeholder group reviewed existing standards and evidence to create a framework that can be used internationally. The new framework is culturally sensitive, measurable and applicable to people of all age groups in all care settings. This table shows the current and future fluid categories. There are a couple of key changes I'd like to highlight. The first is that the category names are changing. For example, mildly thick is currently level 150, on the new framework it is level 2. You'll also see from the table that the color classification has changed. For example, extremely thick is currently blue, in the new framework it's green. Essentially, a relabeling process will be undertaken to ensure our current products match the new framework. Lastly, a new fluid thickness has been added to the framework. This is level 1, slightly thick. Slightly thick fluid is for pediatric patients only. Let's take a closer look at each fluid thickness. Slightly thick is a new fluid level for use in pediatrics. It is level 1, and has grey-coloured labelling. It is thicker than water, but flows through a straw, syringe, teat or nipple. It will be up to each facility whether they introduce this fluid thickness, so it may or may not be available where you work. Mildly thick fluids currently have a green label, but will have a pink label in the new framework. It is currently classified as level 150, but will become level 2. Mildly thick fluid flows off a spoon, is sippable, and, whilst it pours quickly from a spoon, it is slower than thinner fluids. Moderately thick fluids currently has purple labeling, or orange if you use Flavor Creations products. In the new framework the label is yellow. Moderately thick fluid is currently level 400, it will become level 3. It can be drunk from a cup, and it requires some effort to drink it through a straw. Extremely thick fluids currently have blue labeling, but will be green in the new framework. It is currently classified as level 900, but will become level 4. Extremely thick fluids are usually eaten with a spoon, and are too thick to be drunk through a straw. Here's a reminder why we have thickened fluids. Thickened fluids are required by those unable to control thin fluids in the mouth. Thin fluids can spread in the mouth, and run into the lungs before a person can swallow. Thickened fluids which maintain shape and size are more easily sensed in the mouth. They move slowly to the back of the mouth, allowing enough time for the patient to swallow safely. If a person receives the incorrect fluid thickness, those with difficulty swallowing may find liquids cause coughing, gurgly voice, or even choking, which can be life-threatening. If an individual has difficulty eating or drinking, or encounters discomfort, they can become fearful of eating and drinking, and end up consuming less than they need. This can lead to dehydration and undernutrition. The new fluid level and packaging will start to be transitioned into use from the 1st of May 2019. In Queensland Health, each health service will be managing their own rollout, so look out for local communications. Facilities may be utilising current stock before new stock is used, so the timing of changeover for each fluid may differ. Please bear this in mind where you work. What about food textures? Are they changing too? In the future, there may be some changes to food textures. When that happens, we'll share information with you about what the changes are. For now, we are focusing on the changes to the labelling of thickened fluids. Here is what you can do to help the changeover run smoothly.
Make sure you are familiar with the new labeling. This covers the changes to the level names and label colors.
There are posters available that you can display where you work, so you have something to refer to. If you don't see any displayed, check with your supervisor or manager.
A good place to display the posters is where any thickened fluids are stored or served, for example on ward fridges or in kitchenettes, by the tray line, and on serving trolleys.
Find out the changeover dates where you work, and talk to your colleagues about the change to make sure they know what's happening as well. Why not discuss it at a team meeting?
Most importantly, when providing thickened fluids to patients and residents that need them during the changeover period, double-check you have the right fluid level. Also, check their diet code matches the product being delivered.
That's it. Let's recap what we've covered. We've covered what IDDSI is, and how it was developed. More importantly, we've looked at how it differs to what is currently in place. You've been provided with a reminder about why we have thickened fluids, and the importance of getting it right. Lastly, I outlined what you can do where you work, to ensure everyone knows about the change, and the changeover runs smoothly. Remember, the change is meant to start from the 1st of May 2019, but look out for local communications to find out what's happening where you work. We hope you have found this video helpful. If you have any questions, contact your local IDDSI lead, or you can email Statewide Food Services with any questions. Thank you for watching.
So basically that's the video that we developed for the food service staff. There's also one for nursing staff, which the first half was exactly the same, but once we get those extra characters in, it's more contextualised around the ward and clinical areas.
All right. Denise, that's been fantastic. Thank you so much.
You're welcome.
And I'd now like to invite people to, you're welcome to unmute yourself to ask questions, or if you'd prefer to type them in the chat box, you can do that too.
Doesn't look like there's any
Are
questions.
there any questions at all?
No.
Or comments? When you have your state meetings to get together, do you do them via teleconference, or you physically come together?
No, we have to do them via teleconference because we're spread out from the Gold Coast all the way up to Thursday Island. So yeah, we're very used to teleconferencing in Queensland Health, so it's not a major stretch for anyone to do that. But we are gradually transitioning to Skype meetings because we have that system now set up within our whole network, so that we can share screens and do things like you're doing now.
Yep.
Yeah.
Great. Oh, thank you. So thank you very much. There's that's just come through that there are no questions, but a thank you.
Okay, thanks very much.
Which is lovely.
Yep.
Anybody else before we let Denise go? I think it's really helpful to talk about the process, particularly with Queensland Health being such a large facility, and you know, looking at the reasons and the rationale behind, you know, a staggered changeover, and that makes good sense. You know, I think you've really got to work to whatever works well for your facility. So congratulations on all of that.
Well, yes, and you we'll see if it all works. I'm fairly confident it will work pretty well. I'm sure there's going to be the odd hiccup, but clearly in any big organisation you can't cover every eventuality. So we'll just make sure that we've got people available to help when the changeover occurs. So that's the main thing.
Fantastic.
Yep. Okay, thanks everyone for listening.
Thank you.